Today is World Sleep Day. We all know New York City is a city that never sleeps, but as it turns out, not getting enough Z's has serious implications for our health and well-being. The sleep when you're dead hustle culture is growing, so much so that the CDC has labeled sleep deprivation a public health epidemic. To help us understand this better and explain how you can start getting better sleep is Dr. Matthew Scharf, neurologist and sleep medicine specialist at Hackensack Meridian Health. Good to see you this morning.
Morning, Mary. Great to be with you.
Tell us more about this sleep when you're dead mentality and the toll it can take on your body.
Yeah, so one thing we've learned over time is how important sleep is. And, we know that it's important to make people feel better. We all know the effects of sleep deprivation, and we all know how that makes us feel. But we also know, we learned over time that it is really important not just to make you feel better, but also to make you healthier. And in fact, the American Heart Association has actually identified good sleep as one of life essential aids. And we've learned over time that not only does good sleep help you feel better, but also it can actually increase your longevity.
What is recommended in regard to the amount of good sleep adults should be getting each day? And when we say good sleep, what does that mean exactly?
Yeah, those are great questions. So when we say good sleep refers not just to the amount of sleep, but also to the depth of sleep and getting the deeper stages of sleep that we need. A typical adult needs somewhere between 7 to 9 hours of sleep. And it's not just it's not just the duration of sleep, it's also the timing of the sleep. We all just had daylight savings time, so we all know how that feels, but getting it also at the right time and a consistent bedtime and wake time is really, really important.
What can people do to make sure they're getting a good night's sleep? And at what point should someone seek medical care if they're not getting enough sleep?
Yeah, so that's a very important question, and people should definitely go and try to maintain a consistent schedule. That is really important, and give people what we call an adequate sleep opportunity. People need to have an adequate amount of time to sleep at night. If it's 8 hours a night, then you need to set aside those 8 hours. And if people are doing that and they're still not sleeping well, they're not feeling well, often that should prompt getting a medical attention and a medical evaluation.
Dr. Matthew Scharf, neurologist and sleep specialist at Hackensack Meridian, thank you so much for your time.
Thank you, Mary. Great to be with you.